Lymphedema. Lymphedema is defined as a chronic condition of swelling within tissues caused by an abnormal accumulation of lymph fluid. The word broken down begins with lymph, which means lymph, and edema, which means swelling. Lymph is a clear, watery fluid containing electrolytes and proteins. It also has an essential role in the lymphatic and immune system, removing dead cells, debris, and pathogens, including cancer cells, from the intercellular spaces. Symptoms of lymphedema include swelling, also known as edema, a feeling of heaviness or tightness in the affected limb, limited range of motion, reoccurring infections, and hardening and thickening of the skin, also known as fibrosis. Risk factors may include older age, excessive weight or obesity, as well as rheumatoid or psoriatic arthritis. The epidemiology consists of two categories of demographics of diagnosed patients. Those diagnoses are known as primary and secondary lymphedema. Primary lymphedema is a congenital condition and affects about 1 out of 100,000 people in the US, developing typically in the lower extremity, starting with the feet and then moving upwards to the ankles and legs. Symptoms are mostly noticed within puberty. An example of primary lymphedema is Milroy's disease. It affects mostly infants. Males with Milroy's disease are sometimes born with hydrocele, an accumulation of fluid in the scrotum. Males and females may have toenail dysplasia, deep creases in the toes, papillomas, and prominent leg veins. Another example is Meji's disease. It's an idiopathic congenital disease defined by abnormalities in the lymphatic system, and symptoms usually develop during puberty, pregnancy, or up to the age of 35. For unknown reasons, this condition affects females about 3 times as often as males. Secondary lymphedema occurs when the lymphatic system is damaged from surgery, trauma, or radiation therapy. Patients receiving breast cancer treatment are most common to develop secondary lymphedema, particularly those that have had a mastectomy or a lymphadenectomy. Listed here are the stages of lymphedema progressing in symptoms, starting at stage 0, where the affected area may feel swollen, tight, and heavy, however, no external visible swelling. Stage 1 may be occasional swelling, but goes away with elevation and compression. Stage 2 is almost always swollen, and the skin feels firmer than the surrounding area. At stage 3, the affected area has significant swelling with changes in skin color and texture. Diagnosis may be found through ultrasound, which examines how fluid, such as blood and lymph, is moving through the body. Blood clots and other obstructions can be detected. Or magnetic resonance lymphangiography, known as MRL, is similar to an MRI, where dye is injected into the lymphatic vessels to map the system and look for blockages. Additionally, CT scan can be used for diagnosis. It uses an X-ray machine to make a series of detailed cross-sectional images of the body structures to look for anything putting pressure on the lymphatic system. Or lymphoscintigraphy uses a small amount of radioactive glucose and is another form of lymph node mapping. Diagnosis may also be found through bioimpedance spectroscopy, which is a non-invasive technique used to measure the amount of fluid in the body. This test is sometimes used to help prevent lymphedema in people who are at risk or not yet experiencing symptoms around stages 0 or 1. Cellulitis is a bacterial infection of the skin that is a common complication of lymphedema and can be potentially life-threatening. Because skin in swollen areas is stretched thin, It is an easier entry for bacteria that thrive in fluid-rich areas. Lymphedema patients may be prescribed antibiotics regularly due to recurrent infections. Untreated cellulitis can spread into the bloodstream and trigger sepsis, which requires emergency medical treatment to prevent organ failure or even death. Sepsis can cause symptoms of hypotension, tachycardia, dyspnea, pyrexia, and delirium. Patients should be treated with intravenous fluids and antibiotics. There is no cure for lymphedema. Treatment focuses on reducing swelling and preventing infection. Specialized occupational or physical therapists can help patients through manual therapy, exercise, and compression. Specialized therapists may work with their patients to do exercises, where gentle contraction of the muscles in the affected area can help move the excessive fluid out of the swollen limb and work on range of motion. Some therapists may be specialized trained in manual lymph drainage, where they use very light pressure in a massage like fashion to move the trapped fluid in the swollen limb towards a nearby area with properly working lymph vessels. Compression is an essential treatment option. There are three types of garments. One is compression bandages, where you wrap the entire limb to encourage lymph fluid to flow back toward the trunk of the body. You may also use compression garments. They are sleeves or stockings, often required by a prescription to ensure that the proper amount of compression is used to promote drainage of fluid. A certified lymphedema therapist can measure a proper fit. Additionally, sequential pneumatic compression is a sleeve that connects to a pump that intermittently inflates the sleeve, putting pressure on the lymph and moving lymph fluid. Lastly is surgical treatment. Lymphovenous transplant, also known as LVNT, is where lymph nodes are taken from a healthy area of the body and then attached to a network of lymph vessels within the affected limb. Lymphaticovenous anastomosis is a procedure that creates new connections between the lymph network and blood vessels to create new drainage paths. Lastly is removal of fibrous tissue. This procedure is often done using liposuction to relieve fibrosis and restore function to the affected limb. I chose to research this diagnosis based on my personal experience working at a physical therapy office. My clinic has one lymphedema specialist currently, and she's scheduled out 4 months in advance due to the demand, and adequate amount of specialized therapists currently in the area. I also chose to research this to have a more empathetic understanding of our patients, and to further understand the frequency and urgency of therapy sessions required for patients within my clinic with this diagnosis to better assist their care. Here are my sources. Thank you for watching.